Requirements impact any company with 100 or more employees. Workers can ask for exemptions on medical or religious grounds.
Some states have already sued over a more narrow mandate that employees of federal contractors be vaccinated. So it's all but guaranteed we are going to see lawsuits come out of this. Joining us now is Natalie Gomez-Velez. She is a constitutional law professor at CUNY. Natalie, thanks for joining the show.
Thanks for having me. A pleasure.
Of course. So viewers know we've been talking a lot about the precedent here surrounding these vaccine mandates, especially when it comes to government agencies mandating it for their employees. So is there precedent in this situation where the president is ordering mandates for private companies and not just for federal workers?
So yes, there is. And it's interesting. There have been a number of cases involving vaccine mandates by the states. And usually when we're talking about these kinds of public safety and public health measures, they were the states, and challenges to vaccine mandates there. Most of the mandates have survived those challenges. Some are still ongoing. This is a matter where the federal government is being kind of creative in terms of using its federal power, because the federal government can only act pursuant to its enumerated powers and within these federal agencies. And so yes, there is authority for the mandate within the bounds of both the federal contractors, and here the administration is using OSHA, the Occupational Safety and Health Administration, and its statute to say, you know, basically we're going to mandate vaccines or testing and masking for workers who are subject to regulation, well, some of them anyway, 100 of those workplaces with 100 or more. So there is authority from the perspective of workplace safety, but you're right to say there will be challenges as well.
Well, let me ask you something. The president's rules are even tougher on people who are working in the hospitals, nursing homes, or any places that get money from Medicare or Medicaid. So they don't have the testing out option in those cases. So from your point of view, does Medicare and Medicaid give the president some more leeway here or no?
Well, the rationale, like the reasoning for not having the opt-outs within, when we're talking about circumstances involving healthcare workers, is, you know, you're really in an environment where the key goals are really to keep people healthy and safe. Here, I think there's more leeway with respect to broader workplace regulations, because they're casting it within the bounds of the statute that calls for regulation of workplace safety. And the way that this rule is crafted is it's basically identifying the COVID pandemic, the COVID-19 as related to unvaccinated workers as posing a grave danger, and then providing for this rule to require either vaccination or that there is masking and testing that goes on as a matter of workplace safety, not for healthcare environments, but for other workplace environments.
Okay. And Natalie, we've already seen several red states. They have laws banning proof of vaccination requirements. How do you think that's going to impact Biden's new rules?
So it's interesting. There may be challenges to the federal rule, but if it's determined, and I believe there is authority for it, that they're acting procedurally in a way that is appropriate. If that rule stands, then it will preempt conflicting state laws and rules. So, for example, if there's a state that says there can't be any requirement for masks, the federal rule will preempt that rule where it applies, right? So in those workplaces that are within the purview of that federal rule, 100 or more workers that are under the, within the regulatory authority of OSHA.
So OSHA says companies who don't comply could face penalties of nearly $14,000 a violation. But how exactly are they going to enforce that?
It's a really great question, right? Because they're, you know, staffing, how do you manage, you know, overseeing enforcement of so many? They've structured it so that it would be complaint driven, or, you know, so workers in workplaces who see that they're not enforcing properly, not checking for vaccination status, not requiring masks for unvaccinated folks, not requiring testing, they're relying on the fact that they will report. And I think the Biden administration is sort of relying on this as a way of going beyond just encouraging people, but, you know, putting some cover for some employers who really would like all the employers to either get vaccinated or take precautions, and also for those in workplaces who really are concerned. It's about public safety, getting people back into the workplace, helping the economy, and I think that that enforcement mechanism is designed to be through complaints where folks who are concerned about safety at the workplace will let OSHA know, and then they'll bring enforcement actions on that basis.
Right. Well, this will definitely be a multi-part conversation. Natalie Gomez-Velez, we'd love to have you back. In the meantime, thank you so much for joining us.
A pleasure. Thank you.